What's going on, everybody? My name is Grant Jones, and we want to welcome you back to another episode of Goodera's Impact Podcast. Now, on this podcast, we talk about critical issues going on in our society and in the world at large. We also talk about how we can partner with nonprofit organizations to help resolve some of those issues. In today's topic, we are talking about caregiving with childhood health. And today we want to make sure that we are understanding how to make sure that we are growing and making sure that it's optimal for the children, whether it's in a safe environment, whether we're making sure that it's adequate nutrition. We want to make sure that the children are feeling safe. We want to make sure that they're in a safe environment. And we also want to give them opportunity to education at birth. We don't want to start at age 6. We want to make sure that we get it right away. In 2020, the World Health Organization issued the first guidelines for early childhood development. Evidence shows that early childhood development is an outcome of healthy, nurturing interactions between caregivers and children. As such, the guidelines focus on the needs of both caregivers and young children. Children whose care distributed or distorted in some way are at risk of not receiving sufficient nutrition, being subject to stress, not growing well, and not being psychologically stimulated, and of developing malnutrition. Warm and responsive caregiving is now known to extend some protection to children in otherwise adverse situations. The Ronald McDonald House is a global organization that works extensively around the world, helping families in need that need medical care, meal assistance, and anything that makes them have a better and safer future. Now, just a few weeks ago, I had the privilege to actually go to the Ronald McDonald House in Rochester, and I got to meet the communications director, Jacob, where we got to see everything that they do at the Ronald McDonald House. We have a cool video we want you guys to check out. Here it is. The Ronald McDonald House is a global nonprofit organization that provides comfort, care, and support for families with children who are sick around the world. I had the privilege of visiting the office in Rochester, Minnesota, to experience firsthand the work that they are doing to help children and families in need. The nonprofit helps families across the world get access to medical care and support systems. To date, they have run over 690 programs and helped provide over 2.2 million night stays for families that travel outside of their hometown to get medical aid for their children. They are present in over 62 regions across the world. And you should check out their work and help volunteer for their cause through the local chapters in your region. All right, ladies and gentlemen, after watching that video, we actually have Jacob here, the communications director of the Ronald McDonald House. Jacob, how are you doing today?
Doing great. Thanks for having me.
Thank you, man. I really enjoyed our time, and I learned a lot from the interview and everything that we did today, and it's really fun. So let's go ahead and get into it. So first question for you. How did the Ronald McDonald House form? And how long has the Rochester organization been active for?
Well, Ronald McDonald House Charities as a global organization started back in 1974 out in Philadelphia. And so it was kind of the brainchild and dream of a doctor at the Children's Hospital there who got connected with the Philadelphia Eagles organization as well as McDonald's. And so that's sort of how it all came to be. As far as our chapter here in Rochester, now known as Ronald McDonald House Charities Midwest, Minnesota, Wisconsin, Iowa, we were founded as Northland Children's Services back in 1980, and we simply operated a 12-room house at that point. Similar to how RMHC started out on the East Coast, we were just a collection of about 4 local families who just had this vision for providing extra hospitality for families who were traveling to Mayo Clinic. And so from there, we got connected with the local McDonald's owner-operator, who then petitioned for us to become an officially licensed Ronald McDonald House. So that actually happened for us in about 1990, where we took on the name and took on everything that came with it, the brand. And since then, we've expanded twice after moving once. And now we operate a 70-room Ronald McDonald House in Rochester, Minnesota, which is the largest in the state and the 13th largest in the country and the 18th largest in the world. And when I say that, to put it into context, there's about 387 Ronald McDonald houses across the world. So the fact that we're able to have such a large house in a relatively small community, all things considered, really speaks to the expertise that's happening at Mayo Clinic. And we're just really proud of what we're able to do and the support that we have from our local community.
Man, that's amazing. Just starting from like 12 houses, right? And then just being able to grow from that. Can you talk about how that feels for you, right? Just being a part of an organization and seeing that growth over time. Talk about that for us real quick.
Well, that first house was only 12 bedrooms. So when you think about that, I mean, they probably weren't very big bedrooms, and that's probably all that the house really was able to contain. They probably didn't have some of these community spaces that we have now, some of the extra things that we provide, which I'm sure we'll get into later. But then to go from those 12 rooms where we've, as I said, moved to a new location, expanded twice, 70 guest rooms is incredible. Each guest room at our house can have up to 5 family members staying in it. So on any given day, our facility here on 2nd Street in Rochester can have 350 people staying in it from across the world. And it's really just, it's incredible. And it speaks to the dedication, as I said, of our local community to provide this hospitality. It speaks to the dedication of our volunteers, because we couldn't do what we do without the donations we get, without the volunteers we have, and the people who are constantly sending our house things to make their stay easier. And so it's been quite the journey. And now we're to the point where we have exhausted this physical location. We won't be able to expand anymore. And so now we're starting to dream bigger. Where can we go from here? How else can we serve families in other communities nearby, or where there's other Mayo clinics that we can partner with? It's an exciting time. And so we're very blessed to have what we have, but we never stop thinking about how we can support more children and more families.
Yeah, once again, I love the answers that you're giving because just you're seeing the growth, right? And from time A to time B, you can see, oh, we can't do this anymore. We're going to need more help, which kind of leads me into my next question. And you might have brushed it. I just want a little deeper answer. You talk about the volunteers. You talk about people that really want to be there. Can you talk a little bit more about your mission statement, the why, right? The why we're doing this and everything. Once again.
So the mission statement is to provide a home away from home for children and families who are traveling to Rochester for medical care at Mayo Clinic. And for anyone familiar with Mayo Clinic, it's one of the best hospitals in the world. So we're starting to see more people come from further away, come for longer periods of time. And so we really have the greatest need we've ever had, but we've already seen the response to that need has been equally as great. We have volunteers who are regular volunteers at the house and provide extra stability for the families who are staying here. We have consistent donors, whether it's individuals or businesses. It's been incredible to see the support that we have for what we do, especially considering the majority of people who support our house may never set foot inside. In order to stay at a Ronald McDonald house, you can't live in the county where it resides. And so the Rochester people who support our house, they'll never stay at our house. They might stay at a different Ronald McDonald house if they have to go somewhere else for medical care, but they'll never stay at ours for any medical care. And so the fact that so many of them support us in so many ways is, I mean, it's true philanthropy. I mean, they don't expect anything from us except to provide the services that we provide. And it's truly incredible.
Wow, I'm learning so much. I had no idea that the families had to come from somewhere else and then to stay there. So that gets into one of my next questions. Like we're in a line right now. Can you talk a little bit more about the children and the families that you work with?
Sure. So, in order to stay at a Ronald McDonald house, the child has to be 18 years old or younger and receiving ongoing medical care. And the way that that's defined is either they're inpatient, so they're staying at the hospital, and then their family would stay at the Ronald McDonald house, or they're having outpatient care 4 times a week. So, 4 doctor's appointments every week while they're in Rochester. There's other, little nuanced things that they have to do to stay at the Ronald McDonald House, but those are kind of the 2 key elements. And like I said, really, it's just about providing in whatever way we can. When people are traveling to Rochester for medical care, they're coming because it's pretty serious. I mean, as I said, it's a world-renowned hospital. It's not just a doctor's appointment. It's oftentimes for cancer, tumors, things like that, very important surgeries, transplants. And now we're seeing those stays are becoming lengthier and lengthier. And so when people come from far away, we're having people come who have never experienced snow, let alone a Minnesota winter. We're having people come who find out the night before that they have to come here for something emergency, and they're not going home for 100 nights. So they
Mhm.
come with the bare essentials. And what we can provide due to the generosity of our community is everything else. And that's really what we aim to do. So we always say we want all of the parents to be able to focus solely on the health of their child, and we'll take care of the rest. And that's what we're able to do, like I said, because of the great support that we have.
Absolutely. I love it. Also, with that being said, I agree, just understanding that taking that child that's in the hospital, right? And that's a lot of stress that brings onto the parents and stuff. We have to make sure that they're taken care of as well. Can you talk about some of the programs that they have for the children and the adults there at the Ronald McDonald House?
Well, the first thing I always like to remind everyone is that nobody is ever turned away from a Ronald McDonald House for any reason that's financial. And so to stay at our house, it doesn't cost any money for the families who are staying here. Now, some of them do provide, some sort of donation at the end of their stay to thank us, but we run solely on the donations that we receive from local individuals, local businesses, and then obviously corporate partnerships. And we have an incredible amount of support from our local McDonald's owner operators. And so we're very thankful for that. But when you're talking about staying at the house, a lot of people just assume a Ronald McDonald House is a hotel. So even as I talked to you about saying that we have 70 guest rooms where people can stay, you got to look in on one of those guest rooms, and it does essentially kind of look like a hotel room. There's a couple of beds, there's a TV, there's their own private bathroom and things like that. But then you got to experience walking through the house and feeling how it's more of a community living atmosphere. We have a lot of spaces that are shared spaces that families can come out and connect with each other. Every night, they're provided with a house dinner where we have local organizations or groups or businesses come in and serve a meal to everybody who's staying at the house. And so that brings everybody down together for one meal. Um,
Mhm.
we have a family activity coordinator who is an absolutely incredible staff member who plans activities for the children and families. The calendar is full, and it's filled with things like magicians. We have a pet therapy program. We have a music therapy program. They have visiting artists come in. So the kids really get to do a lot more than just go to the doctor's appointment and come back and sleep or watch TV or play video games. We try to make it something that they look forward to when they leave the hospital. And I'm proud to say that that's what I hear from parents more often than not, that when they end up having to leave the Ronald McDonald House because their appointments are over or they're going home, they say their kids are disappointed because they don't want to leave the Ronald McDonald House. And so that's just a feeling that you can't really put a price on. And thankfully, we never have to, because we have such great support for what we do that we don't have to ask those families for anything, and they're able to just come and enjoy what we have to offer after they go through very difficult days.
Yes, and amazing because when we had that tour earlier a few weeks ago, when you walk in there, you get a sense of community, you get a sense of family, right? And so because these people are in shared spaces and they're having fun, they're getting the resources that they need, that's a sense of involvement for the family. So anytime you leave family members, something like that, you're going to feel a little bit sad or something like that. So it really shows the impact that you guys are having on these people's lives where maybe their family is dysfunctional or they don't have the time or something, the resources, and now you guys are providing the resources for them. With that being said, do you have any programs that really stick out to you? I know you saw the movie night that you were telling me about during the tour. Is there anything that the number one program that you had to see from everyone's experience? What's the favorite?
Well, I think without a doubt, I already mentioned house dinners are something that families always talk about because, we obviously have things available to them all the time, like snacks that they can grab on the go as they're heading to the hospital or coming back. But the fact that they can come back and they have either a home cooked or a catered meal waiting for them, and that all the other families can come down to the same place and enjoy. It's really been a place where you hear about connections being made, families talking to each other, because even though they might be on a slightly different journey, they're all on a very serious medical journey. And it's something that they can relate to one another about and be a support system for each other. And so, like I said, we have a great staff, we have great volunteers who provide support, but it really is secondary to the support that they can receive from another family that's going through something very similar. Having that type of connection is invaluable, and they're able to form that in particular at house dinners. One other program that I did mention as well in passing was Paw Pals, which is our pet therapy program, because a
Yes.
lot of these kids and families have to leave their beloved pet at home. And so thankfully, we have an incredible volunteer group who bring their dogs, trained pet therapy dogs, to the house and just sit in the heart of our home. And kids can come and just pet them, play with them, just get some interaction with a beloved animal. And so that's another thing that kids talk about forever when they leave the house. They'll come back the next time and they'll ask which dog is coming that day or which dogs are coming that week, and they're always very excited to hear when they're coming. It's just something that they can look forward to, and that's really what we try to provide, something that the kids can look forward to when they leave the hospital.
Absolutely. And with that being said, there's just so many things that everyone's learning about this program. Can you talk about what you have learned with your years of working with the Ronald McDonald's House? Anything that's touched you, or anything that you're learning more about yourself about, oh, I didn't know I had the capability of giving so much more, right? Or anything that's touched your heart throughout the years of working with Ronald McDonald. We'd love to hear about it.
Well, I think the biggest learning that you always have in a lot of ways at a place you work is that the need is so great, right? And so we talk a lot about the expansion that happened. Well, the expansion happened because we were turning away about as many families as we were serving in a single year. Because they would come to Rochester, they would try to stay at the house, we would be full, they would go on a waiting list, and sometimes they would go home before they ever got into the house. And that was something that our supporters said that just can't happen. We need to find a way to be that home for everyone. And so then we expand, and now we're serving more families than we ever have before. And we do not have a waiting list. They come to Rochester, they get their referral from Mayo Clinic social workers, and they're in the house that day. And it's a feeling of just extreme pride to be able to provide that without having them wait, without telling a family, we understand that you're here for something serious, but we need you to pause because we don't have space right now. We don't have to do that anymore. And so I think, when you see how great the need is, then you oftentimes find out just how great the support is and how great the people are who are around you. And so I think, as someone who's not native to Rochester, Minnesota, being able to see the community rise up and really pour into our organization to make sure that we are being that house, that home for people, was just something that was really unique and really neat to see. And so I think that would be what I would say. The need remains great, but the support seemingly is greater.
Absolutely. And it seems like you guys, and from an employee standpoint and corporate partners, you guys have your own family as well too, because no one can just do it on their own, correct? Can you talk about the support you get from like the corporate partners? You touched on it a little bit. Can you go in a little bit more detail, maybe about like where you guys get food or like who's supporting you here and there? Anything that you guys can disclose?
I already mentioned McDonald's as our local owner operators, and they have a number of stores throughout southeast Minnesota, western Wisconsin, and northeast Iowa. And as a organization for them, they are one of the leaders in what is known as Roundup for RMHC. And so if you go to a McDonald's restaurant, you're oftentimes asked, will you round up? And what that means is you go from whatever change you're paying to the next full dollar, and that difference goes to support Ronald McDonald House Charities, the global charity, as well as the local Ronald McDonald House chapter, and that's us. And our McDonald's owner operators, they are, I believe, one of the leaders in the nation and in the world for Roundup. And it's incredible because it's not a very large community, as we've said. Rochester, is what, 120,000 people, And yet somehow our McDonald's are leading the way in getting donations for our charity. And I think it just speaks to what the value is of their organization as well. They know how important it is to support our charity, and they instruct their employees, and their employees get to experience it as well. We've had their employees come to the house, serve a house dinner, spend time with families. And really, when you can do that, it really just makes the mission come alive. I mean, you got to walk through the house, and I'm sure it means something different to you than it even does maybe to your coworkers, just because you got to physically see some of what goes on. And so we love that. We love whenever people can come to the house. And so thankfully, like I said, we have such great support from the local community that a lot of our local restaurants, so not even restaurants that people would know outside of Rochester, but they support us in so many ways. And like I said, house dinners is one of the biggest one that people can support us in. And so we have a lot of people who do that. We have some fundraising events that have annual sponsors that have been the same sponsors for a decade. And so we have businesses where if you go to our website, go to our social media, you'll see these businesses on those pages because they are consistent. They are here year after year, month after month, providing support for our house and our chapter and our families. And so that's just what I would say. I would say, look for who we're putting out there because those are the people who are supporting us regularly.
Gotcha. Awesome. We have a few more questions. We want to be respectful of your time. Appreciate you being here. Two more questions. This one goes out for anyone watching right now. Say they see this video, they want to get involved. What are some activities? What are some things that we can do so we can help you guys grow that expansion that you're talking about?
The most obvious thing for a nonprofit is donations, right? And so I always put that out there that if anyone wants to donate financially, that's incredible, and we love that. We also put out there regularly ways that people can support us with in-kind donations. So our local Ronald McDonald House has a Amazon wish list or a Target charity registry or a Walmart, registry as well, where you can just go and buy things that you would normally use and send them to our house so that our families can use them. I think that's one of the most surprising things for a lot of people that they forget. Like when you go home on any given day, what do you do? What do your kids do? Well, they run to get a snack, or they have to use the restroom, or someone spills something and you have to clean it up. And everything you use at home, a family needs to use here in some way. And only through the donations that we receive of Clorox wipes, of Kleenex, of paper towels, of things like that, can we really provide for all of their needs. And so that's a great way to just be on the lookout for when we put out asks for items of highest need. You can just put those into your online cart and ship them directly to the house. One of the easiest ways that you can support. But then obviously the one that I love the most to put out there is volunteerism. I hear way more often than not from families that those first two things matter a lot, but the people who they get to interact with at the house are really the thing that makes the difference. They come back to the house and there's a volunteer sitting at the front desk to greet them, ask them how their day was, and they truly care. They're truly there to listen, to see how you're doing, and to see what you need. And parents appreciate that more than any dollar, more than any item, because it's something that, like I said, you can't put a price on. And so we love volunteerism and bringing in people who can volunteer regularly. But then if you're a business and you're looking to do volunteer days, our volunteer director can set you up with things that you can do like in a single day for a big initiative to support our house. And there's just a lot of ways. So I always just encourage people to reach out, follow us, so that you see what opportunities are out there, because we're going to make sure that what the opportunities are and when they're happening, because we want you to be a part of this. It's not just our thing. It's everybody's thing. We're trying to provide, a safe, welcoming space for people coming from far away who are experiencing some of the most difficult days of their lives, and you can make it better. And so here are the ways you can make it better.
Absolutely. And you kind of just touched on my last question. It was give us one tip for how we can amplify impact in the space. You pretty much said it right there through all of it right there. And also, I want to ask you, just from your years of experience, right? If you had one milestone that like, wow, I did that, right? What would you say that would be like the most warming, touching feeling that you got from that experience, where it's just like, not trying to make you cry on camera or anything like that, but what was that one touching experience that you can share with us real quick? One example.
Without a doubt, the best days at my job are when I get to interact with the families and I get the unique pleasure of sharing stories. And so that doesn't happen every day because a lot of families are going through very tough things here. But oftentimes, when families have reached the end of their journey and they're going to head home with their kid, they ask me, what's the best way we can help you? How can we make the house known to other people? And I always tell them, if you're willing to sit down with me and share a little bit about your experience, we'll write up a full family story. We'll put it on the website, we'll put it in a newsletter, because any communications director for any nonprofit can tell you why their organization is great. The thing that's really going to have an impact on people and how they give and whether they volunteer is if they hear from the family why it mattered so much. And so I always say, you go to our website, and one of the first things you see on there is read about our families. And you can click that, and there's just pages and pages of family stories that I've been able to write in working with the families to share their story about the medical journey that they were on, but then how the house impacted that. And really, when I say how the house impacted it, I mean how everyone impacted it, because we need every donor who's giving money to make those house dinners happen. We need the people who are serving the house dinners to be here so that all the families have somewhere to go and gather and share a meal together. We need the volunteers who are welcoming them into the house. And so everyone has a huge impact, and those family stories are without a doubt the best thing about my job. Hearing how we were able to be there for someone when they didn't know where they were going to go.
Yeah, absolutely. Thank you so much. And it just warms my heart hearing these stories too. And it makes me go, oh man, I want to give back more and I want to get involved even more. So really, we thank you for your time. One more time, ladies and gentlemen, we're going to give a round of applause for Jacob from the Ronald McDonald House of Rochester. We thank you so much for coming here and sharing that insight with us. And also, for the viewers watching today, we are going to be talking more to more nonprofits out there and learn about how we can make a better impact in the society and the world that we live in today. If you guys want to check out more videos, please check in at Goodera.com, where you can see previous videos we talked to. And if you want to like, share, and subscribe to this channel, make sure you guys do that to stay updated. That way you can see the next video that we are going to share with you guys. Jacob, once again, thank you so much for your time, and we hope you have a great day. And 2024, we're looking to do more work with you.
Thanks for having me.
Awesome. Everyone take care. Power the world of good, and have a great day. Take care.